Welcome back to the Health Longevity Secret Show, and I'm your host, Dr. Robert Lufkin. Today, we discover the unexpected connections between aging, chronic disease, and inflammation as Eric Gordon, MD, unravels the complexities of the body's response to stress. Our conversation delves into the cell danger response, where we reveal the mitochondria's critical role in inflammation regulation and healing. By probing into the stages of cellular response to threats, we expose the paradox of inflammation, that it's indispensable in short bouts for survival, but ultimately detrimental when it's chronic or prolonged, leading to the host of chronic diseases that we all face. Join us for a narrative that bridges storytelling with deep scientific insights, offering a fresh perspective on the aging process. We also scrutinize the impact of stress and energy on our body's capacity to heal. Dr. Gordon discusses the phenomenon of senescent cells and their role in aging, and how the intricate balance of the body's healing cycle is easily tipped by this sustained stress and inflammation. This episode is an eye-opener to the intricate dance between our cells and the environment, and how this delicate interplay affects our overall health and longevity. So, for anyone interested in taking charge of their health, understanding the nuances of their body, and embracing a personalized approach to wellness, this episode is an essential listen. Join us on this journey as we connect the dots between science, health, and the art of living well. This episode is brought to you by L-Nutra, maker of the prolonged fasting mimicking diet. Please support this podcast by checking out their website and taking a look at their amazing products. And now, please enjoy this week's episode.
And I'm very pleased to have Dr. Eric Gordon with us today. And the topic we're going to be talking about is aging as another chronic illness. So, Eric, it's such a pleasure to have you here.
Well, thank you. Thank you. It's a pleasure to be here. And I love the topic. As I think I was telling you to begin with, I've always focused on illness rather than on wellness, because I never really knew for sure how to help the individual for wellness, because it's so individual. While once somebody was ill, it gets clearer and crisper, the areas that need support. But after doing this for a long time, I've come to learn a lot about what I think also is involved in staying well and in healing.
So let's get started with your perspective on aging and how you see that, and how chronic illness fits into that picture.
Well, when I focus on the inflammatory part, and I'm sure every story about aging has validity. Okay. It's like, I said, one of the things I emphasize is what we'll talk about today is something called the cell danger response. And all these concepts that people use, whether it's, in the old days, it was the oxidative stress theory or radical, free radicals, or they're all valid. They all inform us of an aspect. To me, why I focus on inflammation is because it's the way the body tries to protect itself is inflammation. There's nothing wrong with inflammation. In fact, that's why I found the cell danger story, if you will, that Dr. Robert Navio has published, has put together and helped really teach the world a little bit about as so useful, because it lets us understand that many of the things that we label as pathologic are only pathologic because they're unrestrained. Okay. The healing mechanism is inflammatory. Okay. It's just that it should be a cycle. You should start inflammation and then slowly resolve it and go back to a more steady state of just preparation and healing, but not active inflammation. And all chronic illness is persistence of inflammation in some tissue, in some organ.
Mhm.
You know,
Well, you've mentioned a couple of times the cell danger response. Can you explain what that is and how it plays a role in this picture?
well, it's a concept. It's not a thing. I always like to start with that because it's a concept to understand how the mitochondria, which everybody thinks about as the energy producer of the cell, is actually also the modulator of inflammation and healing in the cell. But so, and it's just to understand. I think the best way to step back is think of healing on the everyday level. You know, when we during the day we're busy, you know, eating, and at night we're busy kind of like breaking down tissue a little bit and trying to recover from the day's stresses. Okay, and so that's but even during that time, the cell, your cells are involved in transient inflammatory episodes. You know, but when you get sick, and this is where the cell danger response comes in, when you're sick, those transient episodes of breaking down tissue and rebuilding tissue become much greater. I always say it's the difference between, you know, patching a hole in your wall, like there where a picture was, and calling in the contractor to rebuild the whole room, you know, to tear it down. See, the cell danger response is when you're tearing down the room and rebuilding it. So and it's broken down into 3 phases, and 3 phases reflect the three types of mitochondrial function. Okay, because people think of the mitochondria as creating energy, you know, through ATP and the electron transport chain, and that's what they do when the cell is functioning normally. But when there is danger of viral infection or trauma or a toxin or really anything, the first thing the mitochondria does is it senses that it's not getting all the raw materials and the electrons that it's supposed to, and it begins to brown out. It begins to actually make less ATP, and it begins to do something very special. It puts ATP, it increases the amount of ATP, which is the energy currency of the body, on the cell surface. And at this point, ATP, instead of being used for energy, is being used as a signaling molecule. Okay, just like people think of hormones. Well, this is a local hormone, a very paracrine effect, a very local effect. But it signals that this is a cell that's sick, which will call in the immune system. And inside the cell, once the that mitochondria is making less oxygen, is making less ATP, it's also using less oxygen. And this makes more oxygen in the cytoplasm, which creates what we've always called oxidative stress. And everybody thinks oxidative stress is bad, but oxidative stress is life-saving if it's transient. Okay, it's what lets your cells kill things inside of them. You know, it's very important. But if you stay there, you begin to have chronic inflammatory diseases. So that's the CDR1, where you're having the acute viral infection or trauma. You know, and both of these involve calling in the innate immune system, the neutrophils.
So the cell danger response is a response to a dangerous situation, a dangerous biochemical situation, such as a toxin?
Yep, such as anything. See, that's the point, is that it's not, it's an overriding story. See, I mean, you can go into the weeds and bring it down to very, very specific biochemical details. But what it does for us is gives us a story. And we need story because when you try to understand health and wellness, as well as chronic illness, you need a story. When you try to just understand things at the very deep biochemical levels, you're always going to be wrong, because we don't, I mean, if you read the literature, you quickly drop into a morass of acronyms and proteins and genes that we still don't really understand what they do, but it sounds very much like people know what they're talking about. But at the end of the day, the complexity is overwhelming. So to really understand it, we need story. And I think there's more to the CDR, much more. But before I go into that, I think it's because it's too easy to get lost again in the detail. Let me talk about a little more overriding picture that I think people will understand easier. Okay. And that's the difference between what we call functional illness and pathological illness. Okay, in medicine, functional illness is things like irritable bowel syndrome, where the tissue isn't broken. Okay, you can scope somebody with irritable bowel, get a colonoscopy, they look in there, and it looks normal. Okay, you can have a lot of pain, a lot of diarrhea, a lot of constipation, but the tissue looks normal. So we call that functional illness. Now, it used to have a little bit of a, not such a nice meaning to it, because it used to be the polite word that doctors used to suggest that it was psychological. It was all in your head. All
in your head, right.
Yeah, I mean, and we want to remember that everything is in our head. So there's no such thing as I always tell people, I've known people who've been severely anxious their whole lives, and they're not sick at all. When you get really ill, you will get more anxious often, but you didn't get sick because you're anxious. That's one of the great fallacies of medicine, I think, is to think that the psyche will allow illness to persist, but I don't believe it. It rarely will create it. It takes usually a bunch of other stuff happening at the same time. But anyways, I digress as usual.
Right, but we can get into the role of stress in this process, but let's get back to your
exactly.
Your story.
You'll have to ride herd on me. I'm able to go lots of different directions very quickly. So getting back, functional versus pathologic, because this is, to me, the key understanding of why I believe inflammation is about aging. Okay, so in functional illness, it's a whole body process. Okay, pathological illness is local. Okay, you can identify the injured tissue. That's what medicine has focused on for the last at least 100 years, because we got really good at it. Okay, and especially, I always say, not that but many people have felt that medicine has been led by our experience in warfare, and that's why our ability to heal trauma is so amazing, or to not maybe heal it, but to at least treat it. Okay, so that's pathological illness. The tissue is broken, or you have an ulcer, the tissue is destroyed, you have a heart attack, it's local area. And in that, so that's the CDR1 in a way, that local tissue destruction. Okay, because, and when you have that destruction, you have to get rid of, you then have that CDR1, which begins to call in the immune system, and you begin to chew up the dead cells. And then you get into CDR2, which is when you have to call in stem cells and growth factors and begin to rebuild tissue. Okay, and so that's still local. Okay, and then you get to CDR3, where that cell has to mature and the cell membrane has to normalize, because in CDR1 you harden your cell membrane. Okay, because you want to prevent egress of the viruses, and you also want to prevent other bad things from getting in. But in CDR3, that cell membrane is normalizing now, and the receptors for hormones and cell-to-cell communication is being restored. Okay, and so now we're getting to that area of function. Now the cell is going to return to becoming a fully adult member of society. Okay, so it knows the rules, it can begin to interact. Okay, and that's when we start getting to this area of functional medicine, because now it's about signaling that's not working well. Okay, so the tissue is kind of back to pretty much normal, but it's no longer listening as well as it should to the communication around it. Okay, or it's getting persistent low-level inflammatory signals, not enough to kick it back into the CDR1, but enough to not let it mature completely. So it's still either not listening well. Okay, I was going to go into senescent cells, but we're not going to do that now. Okay, but that's another part of this story. So here we have functional medicine. The functional part is about cellular communication. Okay, and that is really coming from the brain on some level. Okay, because you see, you have local tissue damage. Okay, and then you have the signals that the war is over that has to come from the brain. Okay, because see, so again, when I say aging is chronic inflammation, it's because chronic inflammation means we haven't restored full cellular communication in the body. Okay, so in a way, it's really poor communication. Because I mean, when you think about it from a psychological point of view, what is everyday stress in relationships about? Is we're miscommunicating. You know, that's why when you go to the therapist, sometimes if you're lucky, if you go to family therapy, you can suddenly hear what the other person has been trying to tell you.
Right.
Okay.
You're open. The communication lines are open.
Right. But what happens in times of fighting, whether it's in war or just in dealing with your spouse who is foolish enough to not realize how right you are all the time, you know, is people aren't listening to each other. You've stopped hearing, and that's what your cells do. The exact same thing. They stop listening to each other, and so when we want to heal, we have to create the environment that lets cells know that they're healthy. So on one hand, we have the micro, which is the local, the pathology. And I love to study the pathology. And the pathology is full of these micro details of which chemical and which protein or enzyme or gene is off. That is a fascinating world. But if you really want to get back to health, you also have to engage your favorite organ, which is the central nervous system, the brain, in giving the all clear signal that it's safe, because safety is what allows healing, and inflammation is a danger signal.
I love what you're talking about right now. Let me share with you something that I talk to my clients about and see if it has a comparable in your language. So
yeah,
it's
all just different language.
That one of the dangers of always being in a place of stress is that your body goes into defense and protect. And when you're in defense and protect, there isn't the energy to go into heal and maintain. And the body has limited resources, and it's always making a choice. And I think like a cell and the cell membrane, you could think of it in a similar way, where if it's in defense and protect, it limits the energy available for maintain and heal. Does that play a role in your story that you're
That's
talking
exactly
about?
Yes. Like I said, is that what I love is that we're all telling the same story. We're just using different ways of looking at it, because energy is the perfect example. In the CDR1, okay, that first step, the mitochondria is browning out, and that's why, and just for the details of the biochemistry, that's why a lot of people who are stuck have a lot of cells, maybe not their whole body, but have a lot of cells that are stuck in the CDR1, and they're busy gobbling down CoQ10 and PQQ and all these good mitochondrial supplements that don't do anything. It's because that mitochondria has turned itself off. It's not broken. It's part of that self-defense mechanism. Okay, but I digress. I apologize. I just wanted to get in another little story about the CDR1 and understand that the reason I love its richness is because that was always confusing to me. Why some people respond really well to mitochondrial supplementations, and other people, they come in with a shopping bag of mitochondrial supplements and they don't feel any better. It's because their system isn't listening. Those mitochondria have made a decision to slow down, and their cells are busy making all the energy that they can by burning sugar, and that's why they love the sugar. But anyway, but energy is the key, because what people don't understand is that it takes energy to relax. Okay, when you close your fist, when you tighten a muscle, you're using ATP that you've already made. You're kind of falling off the cliff. Okay, when you got to open, now you have to climb back up the cliff or walk up the hill. That takes energy. And it's the same thing in the brain. People don't get that, is that the highest energy use in the brain is to relax. And when we don't have enough energy, our GABAergic systems, the things that tell our brain, that kind of chill things, don't function well, And so, the less sleep you have, the more irritable you are, and the less able you are to heal. Because as I was saying before, the real all clear signal, as you were saying, the real place where people can begin to heal is from a sense of safety.
Right.
And if you live, like you're saying, if you live in chronic stress, if you can't find a place to remember to open your eyes, to look out at the vista instead of looking up your butt, to use a bad analogy, but that's what most of us do. We spend our time with our heads very much stuck in places that aren't useful, round and round that same cycle. Because I think on some level, the obsessive compulsive thinking is really a way to try to make yourself safe.
Mm-hmm.
And unfortunately, the universe has a little joke. It doesn't work that way.
Yeah. And the cell danger response is a normal response until it's overused. Would that be accurate?
Yes. It is the healing cycle. In fact, Dr. Navio has renamed it recently into the healing cycle because it is the healing cycle. It's a response to danger. And when you go through the cycle, you get back to normal sleep wake, because you're always doing a little bit of this tissue rebuilding and tissue, breakdown, every night when you go to bed. It's all part of that, pathways, the longevity people love to talk about mTOR and the AMP kinase, and that's what happens every night. But when you're stuck in the cell danger response, you're stuck in one part of that pathway. You might be stuck in just the breakdown part, or just in the overbuilding. In the cell danger, in the CDR2, you're stuck in that place where you're making more tissue. So you get scarring, you get hypertrophy of blood vessels, you get hypertension, you get diabetes. These are diseases. And you also, one of the off-ramps for this is senescent cells, because senescent cells, are a perfect example of chronic inflammatory, low-level chronic inflammatory signaling. Okay, that probably has a lot to do with aging, because there is quote unquote normal aging. We're all aging. It's just a question of if we can control the inflammation to age gracefully and drop dead, or age with a lot of diseases.
Mm-hmm.
That is the big question. Is how we go about it.
So the senescence is one of the consequences of this process that is not in balance.
Yeah, well, because senescence is an off-ramp for this. If you have cells mostly in the CDR2, again, see, the thing about all models, and I always want to remind people, is don't fall in love with a model. Okay, people do this all the time. They're models, they're stories. We don't know how this thing works. This body of ours, nature, we can build bridges. Okay, and all engineers would probably pretty much agree that this is a stable bridge. If you gave them the mathematical formulas, doesn't work like that in the body. We don't have the handbook. We're making it up. We're making up stories to explain our observations, and we get. We have better and better stories because we've got better and better data, but we're still hanging them together with stories. What was it? Yeah, Plato said that a long time ago, 2,000 years ago. Science is a likely story, and that's all we have. But people get so in love, with their frameworks. And I said, this is mine, but it's got to hold it loosely. don't fall in love with it. It's
Well,
because
but
there's exceptions.
it's an interesting story, and it fits a lot of the data points. With when someone gets their this cell danger response out of balance, so that there's functional illness, what's the road back? What's the pathway back?
Well, you put it well. It's interweaving the local treatment and the systemic treatment, in my mind. Okay, at least because I said I deal with people who, my practice focuses on chronically ill people, the people with, Lyme that didn't get better after the antibiotics, or the people with autoimmune diseases. This is when the immune system has gone off the rails, so to speak, and is really stuck. And what I have seen over the years is that it's a combination of what I call Band-Aids, which is the use of, drugs or herbs, doesn't matter what it is, to kind of quiet down a symptom, to lower the inflammation in the local tissue, and to change the milieu, okay, which is to change the environment in such as, the simple things are, you got to teach people how to breathe again. You got to teach people, you got to work on the sleep. Sleep is really hard because it's, when you're chronically inflamed, you got lots of noise going on up here, and lots of systems are activated. It's not so easy as like sleep hygiene. I always like to laugh at the people who want to tell you sleep hygiene. Well, you have a chronic infection, sleep hygiene is helpful, but often is not the whole story. You're going to need a Band-Aid to help sleep. But so breath, sleep, sun, nature. It's those are the signals, and obviously, and clean food, the basic things, and a loving, if you can, a loving atmosphere. And these are tall orders, not easy to do, but you need all of that at some levels. Again, the beauty of the human body is none of it has to be perfect. Okay, all of us, we wouldn't be here. You don't need to be living, with the Dalai Lama every day in order to heal. You can still live with your slightly angry spouse and heal. It's just that it's nice to find places where you have some feeling of love and relationship. Perfection is not needed to heal. I think that's very important. Just got to get close.
Right. Taking a step back, what is the impact of chronic inflammation on the organs?
Well, each organ responds differently, but what for most of us, I think probably, I have to say, probably the liver takes the brunt of it. As we get older, the brain takes over. Unfortunately, our inability to remember people's names is the beginning of that little bit more inflammation than we'd like. There's a part of me that would like to believe it's just there's too much in here, but the reality is we're losing it a little bit. But the liver is one that I keep coming back to more and more, because it's true the GI tract is where we meet the world, but where the world really begins to, I think, hurt us is when it starts interacting with our liver, and like half, I don't know, it's 45, maybe 50% already of Americans have fatty liver. Okay, and that low level fat infiltration in the liver is an example of of chronic inflammation because of usually of the foods. That we and what we've done to our gut. It can also be from the bad bugs. But so as this chronic inflammation affects the liver, it affects the quality of what goes obviously into our blood vessels. So we start having our arteriosclerosis, and we start having chemicals that get into our brain, and inflammatory chemicals, because so it's each organ is affected differently by inflammation. And each organ can respond a little bit differently because they have different mitochondria. Okay, I think to taking it back is that, your heart can have 4,000 or 5,000 mitochondria per cell, while a skin cell can have like 400. Okay, and so they'll deal differently with inflammation, and that's why we tend to get our heart is much more sensitive to changes in energy metabolism. Our skin is much more sensitive to changes in hypertrophy, and that's why we have so much more of those issues with skin than we do with the heart.
Yeah. So when you have a patient coming to you with some chronic or functional illness, what's your regimen of how you address that? I know there's probably systemic approaches, organismic approaches, and organ approaches, but how do you approach someone that comes to you with a functional illness, a chronic illness?
Yeah, well, it's kind of, it's always looking for what the triggers are, what the triggers were. Now, because sometimes, it's nice if we find the arrow and can remove it. That's great. But oftentimes the arrow is gone, like the inciting event may have been, a toxic exposure years ago, and your body has dealt with the toxin. It's removed it from the system, but you might have damaged some of the cells in your liver, and they haven't recovered, and they haven't been gotten rid of. They're in that senescent state. They're stuck, so it's just always, but we always start with trying to look back at, like, what was the setting? It's this standard kind of like, and on one level, it's a standard approach. You want to get a very good history, because the history is going to tell you most things. Were you sick since you were a kid? Were you vigorous and healthy? Because the genetic component is huge. Okay, it's where the genes meet your environment is where your health is. So it's looking at, your health, your story, your family history, your exposures, your toxin exposures, your infectious exposures, and then weighing by where you are today what your body can tolerate. Because that's the biggest thing, is that many times you can find, that someone has a chronic infection, but as soon as you start to treat them, they get worse. That's because their body is stuck in a place of sensing danger everywhere. They're stuck in chronic inflammation. And once you begin to try to engage, the immune system overreacts. And that's why, again, that's why inflammation and aging are connected, is because it's this inability to modulate the immune response. Okay, instead of being able to go through those 3 stages of the CDR, you've got too many cells that are stuck. And the reason I emphasize cells is because often it's only 5 or 10% of cells in your liver or your kidney, or some organ that is stuck in this inflammatory thing. That's why you're not dying. You can stay in this state and live to your 80, or 90. It's just that you feel miserable. People with you run into people with chronic fatigue and fibromyalgia who are well into their late 70s and 80s, and like they just feel bad, but they're not dying.
So take us through some of the approaches you engage with them.
Well, so then, again, so the first step, again, is history, going through all the possibilities. And then we have to decide what pickup stick we can move. Okay. Because the thing is, can we just go after an old unresolved infection? Because many times they are present. Or do we have to, do you have, or is your body just overreacting? You had, like, for instance, one of the DNA viruses, one of the herpes families of virus that we know stay in the B cells, quiescent. But if you get stressed, when those B cells decide to reproduce, you expose your body to some of those proteins again, and your immune system goes nuts. So maybe we just have to quiet down the immune response. Or many people, a big thing today is this mast cell activation, which is huge for people with chronic illness, that their immune system just way overreacts to very small stimuli, because you're no longer discriminating. I mean, it's a failure to communicate, to use an old line. So I said, this thing is looking at what we can remove, what we can quiet down. Do we need to quiet your immune response, or do we need to actually pick it up a little bit? And that depends on, whether we have to help you kill something or help you stop killing it and just realize that you better coexist with it for a while. Okay, and then and be able to rebuild that sense of safety. Because if you're always reacting to a low-level pathogen that's not hurting you, you're always giving your brain a message that your body is in danger. And that doesn't let you sleep well. It doesn't let you digest well. It doesn't let it doesn't let the parasympathetic nervous system function like it should. Okay.
So here, are we talking about actually sort of psychological ways that a person can feel a greater sense of safety? Or are you talking about some physical process?
Both. Whatever, see, it just depends on what the person can hear and feel. Okay. Some people do really well with biofeedback or meditation, breath work, walking. And in some people, that's not going to go anywhere. They are so frozen in like whatever. For some reason, they're stuck, and that's just not working for their bodies. There's no judgment there. Just sometimes it can't go. And then you have to use herbs and medications to get them to a place where there's a little less pain, a little less inflammation. I'm not talking about using opiates, but there's lots and lots of tools out there to lower the inflammation, to get the immune system to feel more comfortable. And then they can engage those healing mechanisms that are more in the quote unquote psychological realm. To me, there's no difference between psyche and soma. I mean, in order to think, we break things down, but at the end of the day, every brain cell, not almost every, but many brain cells have the same, they respond to the inflammatory signals. The immune signals, will make you depressed or make you angry. So it's all one bag of soup. It's just what your body can hear. So in some people, we can go right to the functional. We can involve your brain early. In other people, we have to really work with the body first. And we do a lot of physical work. I have a lot of people who, whether body workers, I hate to call it, it's using cranial work, cranial sacral work, energy work, a lot of the different electrical machines. It just depends. You have to be careful though, because really sensitive people can blow up from things that everybody else thinks are absolutely safe. Like the electromagnetic field, the healthy like the pulsed electromagnetic fields were wondrous for some people. Some people, they're too much. So that's what I do is I work through what the body can hear. Okay, and we just listen. It's a dance. Okay,
Yeah,
it's not a prescription.
Yeah, I find that a lot of people in this category of functional illness have tremendous kinds of sensitivities that you take them down a path, but then they have a reaction to it. And so it sounds like you have to pivot very quickly with how you're approaching what your approach is.
Yeah, because you're right. I have people who react to water. I mean, and when I was younger, when I started, the famous Dr. Eye roll. People, go, yeah, like, I remember when I first started hearing these people, I wanted to believe them because I do believe that nobody's coming to me to lie to me, but it sounded so outlandish that these things could cause so much trouble for them. But after working with them for 30 years, yeah, it can. You just have to respect that. And you have to, it's like playing chess and you feel like you're always being checkmated. And you just have to keep finding a different approach. And not always, but sometimes we do. I mean, and it's funny because people who are super sensitive, you'll find that some of them, they can't take any herbs, and yet they can take drugs. I mean, it's just, it's mind-blowing to find that, these people who like herbs will make them sick as a dog, or even energy medicine will blow them up, and you can give them a drug, and it's like, and they respond. You just have to keep an open heart and an open mind on what that individual will respond to. And that's why we use a lot of, interestingly enough, the people who can tolerate them, a lot of the intravenous techniques can sometimes get information in a way that kind of bypasses the body's normal, because most of these people have become our window on the world, okay, our eyes, our ears, and our nose and digestive tract have become so hyper that, funnily enough, if their skin isn't too sensitive, and sticking a needle into their vein doesn't freak them, which it can. Some of their sympathetic nervous systems are so wired that their veins become hypersensitive. But if they're not, we can get a lot of changes in people who can't tolerate anything by mouth through their veins. It's just kind of the magic of dancing with this. And this is, so these are the things we've learned for the chronically ill. But at the same time, I'm seeing almost all of our tools being used for people who want to stay well. That is the magic, is each one of these tools that really work in sick people, in the right person who's interested in wellness, it can really help them get to the next level of healing, because it's about finding where their chronic inflammatory drive is. Because even people who are well often have under the hood, there's inflammation. There's that high blood sugar. That's all inflammation. I mean, I can't think of any marker for aging that's not that I can't relate to persistent cell danger response.
In this process, Eric, do you look at mindset at all, where a positive mindset might be helpful in this process?
Totally, but you can't. Most of the people I see at this point in time, okay, are people who've been sick for usually 3 to 20 years. Okay, I see very few people who've been sick, well, except since we've had long COVID and some of the vaccine injuries. But most of the people I see have been ill for a very long time. And if we start with mindset, they often get insulted because they've already been told by too many physicians that if they would just take the antidepressant or get therapy, they would be better, they would heal. But as I said in the beginning, this controls your immune system on a very huge level. Again, local pathology will create inflammation, but the persistent self-defense thinking is what will maintain the inflammation. The healing message, the message that the world is safe again, comes from our brains. Okay, so yes, the mindset is critical, but when you feel miserable and you're not, you wake up in the morning, and to even get out of bed either makes you dizzy, lightheaded, or just fatigued, it's really hard to skip to put on a smiley face. Many of these people have learned to, but it's still hard. So we have to go back, and that's what I'm saying, and find the band-aids that can begin to help some of those physical symptoms, and then allow them to engage the hope. We have to find hope again.
Right.
And so yes, the mindset is crucial, but it's hard to start with mindset, though there are many, and we do use, I do have people work with many biofeedback people and cognitive behavioral therapists, and many of the programs that are out there that help realign, because like you were talking about the super sensitive people, part of that is a mindset. Once you've reacted to smells, your body gets real defensive. I mean, if every time somebody walks in, the office you're in, and they're wearing a perfume and you get a severe headache, your body gets primed.
Right.
And so it does become a psychological thing as well. You can cause that severe headache by just suggesting a bad smell.
Well, this has been a really fascinating conversation, Eric. I really appreciate it. Can you share with our listeners how they can find you, or your website, where they might find more information about what you're doing?
Yeah, well, we keep it simple, just gordonmedical.com. That's the website, and like right there there's the thing, we have a wonderful young woman who talks to people and makes sure that you can just press the button for a discovery call, and because we always want to make sure that we're a right fit for people. We really don't like to waste people's resources if we're not the right ones. So we always try to really make sure that it's going to be helpful.
Well, thank you again, Eric. I really appreciate our discussion.
Well, thank you. It's been a pleasure.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for. Also, let us know if there is a certain topic that you would like to see covered, or a particular guest that you would like to hear from.
This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling. The practice of medicine, or the provision of healthcare, or diagnosis or treatment, or the creation of a physician, patient, or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time.